There's a lot of discussion if kids contribute to the spread of COVID-19. The authors of the following paper take an interesting approach to the problem. The authors try to estimate the number of hospitalized pediatric COVID-19 infections in Wuhan prior to the lockdown of January 23rd. A retrospective review found that there were 6 children with confirmed COVID-19 who were hospitalized in the period between January 7 to January 15 in all districts of Wuhan. This was before the lockdown occurred. During that same time, there were 43 pediatric cases of influenza who were also hospitalized in those same hospitals. The authors used that ratio between COVID-19 and influenza patients to gauge the true prevalence of COVID-19 in the region before lockdown. Here's how they did it. They used influenza surveillance data to estimate the number of influenza cases in the entire region during that 9-day period. Based on the age-specific ratio between COVID-19 and influenza cases, they estimated the prevalence of COVID-19 among the pediatric population for the various districts of Wuhan. According to their estimates, there could have been 313 cases of COVID-19 throughout Wuhan during this 9-day period. Under an epidemic doubling time of 7.31 days, they estimated that there could have been as many as 1,105 pediatric COVID-19 hospitalizations prior to January 23rd, the day when lockdown of Wuhan occurred. This far surpasses the 425 confirmed reported cases across all age groups of that day, none of which were children under age 15. In various publications, infections in children under 10 years of age accounted for just around 1% of all infections. According to this trial, we might be missing something. Kids do get sick. We know that the rate at which they get infected could be much larger than we think. Kids could have a much higher incidence of asymptomatic disease. Their symptoms could be different from what we would expect from our experience in the grown-up population. Now, what are the implications? If they do get infected, then closing schools is definitely a good idea. Similarly, if they do get infected, then they will contribute to the number of cases. Due to their low mortality rate, though, they won't contribute to the number of deaths, which will make the overall case fatality rate associated with COVID-19 much lower. This would be a good thing. Another good thing, if they become infected, they will also develop immunity, thereby contributing to a herd immunity. Higher herd immunity will also cause the effective reproductive ratio to go down, which will ultimately stop the pandemic. This is the age distribution of the United States of America as of 2019. The age group of children below 10 years makes up around 6% of the American population. This would contribute some, however, not a whole lot to herd immunity. But if we take the age group of all kids and teens below 20 years, they make up around 12% of the population. This group doesn't get very sick when infected. Their immunity, however, could significantly help to get a handle on the pandemic. This is especially true for countries with a higher proportion of children, as is the case in many developing countries. Please note that we've just recently opened up our entire library of courses to hospitals that are taking care of COVID-19 patients. So if you want to learn mechanical ventilation and other important ICU skills, please make sure to set up your institution with a free group subscription.